You feel comfortable if I asked you then, so again, thinking about, we're talking about law and policy and ethics in here, feel comfortable making a comment about, so why this particular issue would be have such a policy focus, why the government's so interested in it, and then taking steps to tackle it. Does that feel comfortable to you, or?
Sure. Are you going to ask it, or you just want me to answer it?
Either way.
All right.
We'll just cut.
So the interesting journey with this opioid crisis has been related really to overdose deaths. And overdose deaths now outpace automobile accidents as the most common reason for death in our country for those that are in the 50 and younger age bracket. So that's been a big case for federal legislators to see and to work on, so it's become more and more of an issue. I believe as that's occurred, we've also had diversion issues in the community, and so as those things have magnified within the press, we've seen an increase, and an increase not only in overdose deaths, but also in patients that are dealing with opioid use disorder. And that has caused a crisis with behavioral health, so it's become more and more of an issue for states when you think about Medicare and Medicaid funding as they try to deal with money that they have and fixed sources. And then the federal government basically has said, when it comes to the amount of money that we're spending just from Medicaid and Medicare, this is a significant issue of cost, it's a significant issue of life, and so it's become very important from a policy standpoint. It's being pushed, but as it hasn't been addressed by the healthcare community, I would say fast enough. What you see now is states taking action. And as states take action and as the federal government takes action, then there are regulations that actually can be harmful at times to patients with chronic pain, for example, who have been on opioids for years safely, not being able to obtain their medication because of the regulations that are coming out. Drugstores such as Walmart and others implement policies based on state laws. So, for example, the Florida state law says that every opioid prescription has to have an indication. Walmart enforces that in North Carolina as well as in Florida, even though that regulation is not there. So as different organizations try to help, they can also create hardships for providers and for patients within the communities that they're in. But I think all of this has to come down to really prescribers on the front end being able to know the right way to do this and to take the right steps. So it becomes a health system priority that sort of we built our way here and we have to build our way out.
That was great. That was great.